Center. And joining me tonight is Phyllis Fremprong. She's also known as the Fibroid Queen. I'll let you introduce yourself because it's probably easier to tell the people all the things you don't do rather than telling you all the things you do. You're a nurse, you're a speaker, you're a fitness instructor, yoga coach, all around incredible woman. She's had fibroids and the fibroid journey. You have your own fibroid program. So please tell everyone what makes you the Fibroid Queen, and then we'll start talking about fibroids.
Oh my gosh, thank you so much, Dr. Lipman. So as he said, my name is Phyllis, AKA Fibroid Queen, and I am a registered nurse, fitness coach, and yoga coach, and I help women end their suffering with uterine fibroids through a holistic and fitness regimen as I have through the Fibroid Fitness Challenges. And I've been dealing with fibroids for the last 12 years, and I just have found in my journey that lack of awareness, prevention, and just overall education has been a burden to my journey of being able to get the proper resources a lot earlier. So my intention now is to help women get empowered and get educated to prevent their fibroid condition from getting worse, help them overcome the symptoms, and help them prevent their symptoms from getting worse.
Perfect. Well, we're going to definitely dive deep into that prevention and all the things you kind of can do before you end up seeing somebody like me or the gynecologist. So I want to first start because there are some people on here that may not know what a fibroid is. So fibroids are benign tumors. That's important to know. They're not a cancer. They're very common in women, and they're particularly common in African-American women. Probably 80% of African-American adult women have these benign tumors. Now, they're not all symptomatic, but when they are, they can cause a lot of misery, as you alluded to. It's despite the fact that they're benign, they're the #1 reason why women undergo hysterectomy in this country. And we're going to talk about that because I'm hoping one of the things we get from this seminar is that hysterectomy is really unnecessary for benign fibroids. And the average age of women undergoing hysterectomy in this country is less than age 40. And unfortunately, I've seen way too many women under age 30 that have already had a hysterectomy. It's tragic, and we've got to stop this. So that's an important take-home point. So how does somebody know if they have fibroids or not? Well, sometimes women can feel them. They're hard and firm. They're like rocks, and that's how they cause their symptoms, by pressing on things. They can stretch the lining to cause the heavy periods. They can push on the bladder or push on pelvic nerves to cause pain. And so they may be able to feel them. Sometimes it's during an examination with the gynecologist. They may have some of these terrible symptoms, the heavy bleeding, the pelvic pain, and it brings them to the attention of a physician who then does a physical exam, maybe an ultrasound. Ultrasound is common, so they can diagnose these fibroids that way. And so it's usually a symptom-driven thing. And then somebody has to make a decision. Well, what do I do about it? Maybe they're placed on birth control pills. That's a common thing. Some kind of hormone is often the first line of treatment by the gynecologist. And that may be a little odd because not only does the medical therapy not work very well, but while we don't know where fibroids come from, we know they grow with estrogen. So you might ask, well, why are we putting these women on hormones, on birth control, or an IUD that has hormones in them? So we can talk about that. But when these medical treatments fail, and they often do, then usually it goes into the domain of seeing somebody like myself for a procedure called Ufe, uterine fibroid embolization, or a gynecologist for actual surgery, if they don't know about someone like me. And so, sometimes I kind of feel like a mechanic. When the the person's body is their car, and when it's broken down, they come and see me and I can fix it. But wouldn't it be better, and this is where medicine really needs to be going more towards prevention, because if you only get one body, one car. If you take good care of it, really good care of it, you give it the right fuel, and do the right things to keep up with the maintenance as far as your regular visits and screenings and so forth, you'll live a much healthier, better life. And maybe you don't have to get a UFE with me or surgery with the gynecologist. So with that backdrop, let me turn it over to you, Phyllis, and let's talk about what are the ways like we can, for women out there, maybe they have a history of fibroids in their family, like their mom had fibroids, maybe had a hysterectomy for fibroids. Now they may know they have fibroids, or maybe they don't even have fibroids, but they're worried about it. What are some of the front end kind of preventive things that they can do that maybe they don't end up having to come see me?
Yeah, that's a very good question, Dr. Lipman. So a lot of the things culturally we are grown to think are normal. And you went over the typical symptoms, and not limited to heavy cycles, bloating, pain, and anemia. So knowing that that is not normal, and being aware of that, you can make that known amongst your family, amongst your doctor, and that way you can start taking some action in regards to just getting healthy. I feel like a lot of things that are going on with our bodies, especially as women, we are not prepared for as young women. There's not a blueprint of how to be a woman, right? You just grow up and go through all these hormones, get your cycle, and your body's constantly reacting to the environment in regards to xenoestrogens, things that may be causing you to get out of balance. Stress, lack of exercise, diet, all can impact that. So getting healthy is actually a way to prevent your body from getting out of balance. And I believe that fibroids are caused by a multitude of factors, but every woman is different. And this can be a long, drawn out conversation in regards to fibroids. That's why there's no cure. But starting with getting healthy, managing your stress level. And it's easier said than done, but ways to do that is just by physical activity, walking, exercising, mindfulness, being aware of your thoughts. And when it comes to just even your energy, right? And it's like sometimes you feel like you're losing a lot of energy, you're not feeling your best, and that is a sign of anemia. And to answer that question, anemia is where you have low oxygen in your blood. It's not able to carry it to your organs. So it really takes a lot out of the heart, and it leaves you feeling drained and tired. And then also what you're putting in your body and what you're surrounding yourself around. So one of the things is the foods nowadays are not as they used to be. They're processed. There's a lot of hormones within the food. And there's also different things to be aware of. So key to this type of lifestyle, and that is a holistic lifestyle, is to eliminate or take away, just for a while, meat, soy, dairy. Those have been proven to really interfere with our hormones as women. And we as women, we wear stress in our womb. So that really takes a lot. And also just physical activity. So those are things that you can actually start doing now just to prevent the fibroids from thriving and also help your hormones get reset. And those are a lot of the things that we often overlook.
Yeah, no, I think it's great. I mean, just to kind of summarize some of that stuff, limit or eliminate, if you can, estrogenic foods. It's impossible to kind of avoid all of the hormones in the food supply or the water, but certain foods seem to be high in estrogen: the red meat, non-organic chicken, dairy, those things. So if you can limit those, that's a good start. We also like to increase anti-estrogenic foods. There are some foods that you can consume that actually block estrogen. The colored fruits and vegetables, for instance, have flavonoids in them. And those flavonoids block an important enzyme that's important for estrogen production. So when your mom said, eat your colored fruits and vegetables, that's a good reason. She was trying to be fibroid healthy. You can also find flavonoids in dark chocolate, red wine. That's kind of the spectrum where I live. But that's important. I mean, way to get more flavonoids. One of the other things is vitamin D. Vitamin D is, well, it's not a vitamin technically, it's really a prohormone. It's the best anti-fibroid growth factor that you can get. It's very powerful, and there's lots of studies to show that it's a risk factor. If you have a low vitamin D level, you're at a much higher risk of having fibroids. And I mentioned earlier that 80% of African-American women have fibroids. So they disproportionately, if fibroids affect African-American women more than any other racial group. And it's also related to vitamin D, because vitamin D also is very commonly low in African Americans based on the pigmentation of their skin and how we absorb vitamin D through our skin. And so one of the things we like to do in the office is to assess the level of vitamin D in our patients, and it's an easy thing to supplement. And so increasing anti-estrogenic foods, try to avoid the estrogenic foods, vitamin D, and then, as you mentioned, exercise and weight loss, because estrogen is stored in fat. And so if you can lose body fat, you lose excess estrogen. So it's not only good for your fibroid health, it's also good for your cardiovascular health. And so your program of combining kind of all of these things, kind of yoga, meditation, try to avoid stress, like you mentioned, bringing kind of this holistic approach really has a lot of merit.
Absolutely. And I love that you say that, Dr. Lipman. So one thing for me, living a lifestyle holistically sometimes is viewed as not fun. I mean, just imagine a lot of the foods that I eat are vegetables. And the thing is, it's a mindset thing. I really had to look at my life and look what I was experiencing before with the pain and agony with having fibroids, like calling off work and feeling like you're communicating with the doctors and no one's listening to you. I reflect on that, and that reminds me why I'm on this journey of just living my best. Like, I never imagined that I would make it where I can overcome the symptoms I was experiencing. I literally thought fibroids were like a death sentence. That's how I understood it. But through being able to dabble in self-care, like Dr. Lipman went through, and educating myself, being an advocate, finding a community of women that I can relate to, that has all impacted my journey to the fullest. And also,
talk about your journey, because you had fibroids at a young age, didn't you? Like, and you were in your 20s, and I think you had mentioned your mom had a hysterectomy, so you kind of saw, go through that, and like kind of tell us kind of like what you were going through in your 20s, suffering with fibroids, and particularly knowing what your mom had a hysterectomy. That might have seemed like that was your sentence to.
Absolutely, and that was. So at a very young age, around 8 years old, I remember my mom coming home in distress and pain. And as a curious child, being the oldest in an African household, asking questions about health and different things was just not the thing to do. But I asked anyway, and my mom kind of brushed me off. And I asked again, and she said that her doctor instructed her to get a hysterectomy, a partial hysterectomy. And I asked why, and she said fibroids. So I took it as my mom did not know exactly what she got done and what fibroids were. So that name stuck with me, hence Fibroid Queen, right? So I went through, fast forward 20 years, I went through nursing school, and that vivid memory of my mom came through my mind again. So ladies, follow your intuition. So I just put two and two together. Going through nursing school, I may have learned a little bit of something. And then it was time for a wellness checkup. And I asked the doctor, you know what, can I have an ultrasound? And the doctor was like, why? Why would you need an ultrasound? Well, my mom had fibroids. I want to make sure I don't have it. So like Dr. Lipman covered earlier, so ultrasound was the way for me to find out. Because I think about it, if I did not ask for that ultrasound, what would have happened? And so, because I was experiencing the heavy bleeding, the pain, those were my two like problem triggers, right? So, and I was thinking that was normal. So the ultrasound came back and I had a quarter-sized fibroid on my uterus. So I was told by the doctor, you know what, just monitor it. Despite the triggers that I had, just monitor it. And we'll just, we'll just give you we'll see how it goes. So that's what I did. So go back to the lifestyle of what I knew, which was junk food and burgers and, sedentary lifestyle. I graduated nursing school, 30 pounds heavier.
Wow.
Okay. So I totally disregarded my fibroids, but what was really a problem to me was my high cholesterol. I was told that I had high cholesterol in my late 20s. And that was a huge problem for me because after being a nurse and working in a hospital, I was like, I did not want to be like one of these patients here. So I joined a gym. So with education, I was able to make a conscious decision, say, you know what, let me join a gym and start going casually. Ran into a coach, and long story short, that coach was able to prepare me for fitness competitions, something that I never imagined doing, but I just wanted to try it. I wanted to step out of my comfort zone, so I did that. I was able to drop the weight and feel my ultimate best, but stress, I simply overlooked that. I thought I can do everything. And we as women, sometimes we think we can do this, this, and that all at the same time, not knowing everything that we're doing is making an impact, not only on our bodies, but our wombs, right? Yep. So working as a full-time nurse, two nursing jobs, and working out, trying to compete, that was a lot on my body. I wasn't getting the sleep that I need. I was not getting the proper recovery. I was overworking myself. And that's what we normally do as women, is that we overwork ourselves sometimes and we hold in our emotional distress. So after competing for 8 years, I was like, I don't want to do this anymore. That world became toxic. I was surrounded by people that were just not themselves, and I didn't want to be around that. So know that where you are, your environment plays a huge role on your body and your stress level. I met a boyfriend. I was like, you know what? I'm feeling like, I don't know what. And I just wanted someone. So I got into a relationship, and that was the wrong thing to do. So dealing with our emotions, we need an outlet. If we don't have an outlet, we're going to keep all of that in. So I'm saying all of this to say that I feel like this has played a huge role in my development with fibroids, because I got into that relationship and then I got out of it feeling depressed as ever. And then I noticed that my fibroid symptoms got worse. I actually took a picture with some friends, and then I looked at my abdomen, and it was like, man, I look pregnant. And I had a couple friends ask me, are you pregnant? And it's like, I mean, ladies with fibroids, I know you can relate to this. Like, just looking not yourself, like you're not, you don't have a baby growing in there, right? And it's like not the case. So I went back to the doctor, and I was told that quarter-sized fibroid, and this is like 8-9 years later, that quarter-sized fibroid is now 4 fibroids. And the largest one being almost 9 centimeters. So
9 centimeters, that's pretty good. So it's bigger than an orange. It's like about a grapefruit.
Yes, and I had 4 of them, ranging from like 4 centimeters to 9. So I was not told this in a way that I can digest. The doctor was pretty much like, well, what are you going to do? You know, you're you're a Black descent. This runs in your family. So as soon as the doctor started talking to me like that, I just immediately just felt so, I don't know, I just felt so out of this world. I felt like the doors were closing in on me. I felt like, oh my God, what am I going to do? And he gave me just a couple options. You know, well, you can get your hysterectomy, your uterus taken out, or do you still want children? You can get the myomectomy. And
And that was
actually,
it.
that was it. Go
No,
ahead.
no
Yeah,
UFE.
that was actually it. Yeah, yeah.
So he gave
Those
you
were
2 surgical options. He didn't
right.
talk to you about any kind of changing your diet or changing stress. Didn't mention UFE at all, it sounds like.
No, no, not at all.
So
Not at all.
kind of it
So,
went, and that's what happens to a lot of women. They go, it's like early on, even if they have some symptoms, if their fibroids are small or their symptoms aren't very significant, they'll say, well, let's just watch it. And they watch it, watch it, watch it. And all of a sudden, the next thing they know, the symptoms are horrible. And it hasn't, they go from 0 to 60. All of a sudden now, the other day it was just watch. And now it's like hysterectomy. You mean to tell me like there was nothing in between all this time? Like we've been watching these things grow. They started out, as you said, like quarters, or, they started out as small fruit. And then all of a sudden, the next thing you know, we keep watching them until they're grapefruits. And now it's like, okay, now get a hysterectomy. It's like, there's nothing in between. And it's really sad that, we need to do more on the front end, the preventative side, as we talked about. And also we've got to give these non-surgical procedures like UFE its due. I mean, say we've been doing this UFE procedure for 25 years, completely non-surgical and outpatient, yet I see women still every day in the office that have never heard of UFE. And it's really sad. We kind of go from 0 to 60 here, and it shouldn't be.
right. Absolutely. Absolutely. So, yeah, those were actually the only 2 options that were given to me. So I stormed out of the office in tears, and I nearly went into depression. And that is something that's very common with fibroids, is that we are sometimes grown to just suffer through the pain. As women, culturally, we are grown to think that, you know what, this is normal, and just to take it in and just keep taking it until you somehow blow up. And that's what I did. So about 3 weeks, I just kind of just stopped doing everything, like life stopped for me. And I just woke up one day and was like, you know what? I can't keep living like this. I got to do something with my life. I got to take control. And I guess something hit me with my intuition again, and just knowing that I knew there was more to life than just pain and suffering with fibroids. So I started using my knowledge as a nurse, as a fitness and yoga coach, and I just used that to create a regimen. And this regimen entailed natural remedies, mindfulness, and then different types of movement to really activate the circulation in the womb and flexibility around the uterus. Also, just the eating and being mindful of that. So I do follow the 80-20 rule. And that is something that I want women to know, that you can do this. You don't have to, your life doesn't have to stop because you can't eat this, you can't eat that. But the thing is, majority of the time, you have to take in foods that your body can use. And like we said earlier, starting to eliminate or take away meat, soy, dairy is a start. And then also cleaning out your gut. It's one thing to go from eating meats and unhealthy diet to go to plant-based the next day. Your body, you're going to be malnourished because you went from an acidic environment to a plant-based lifestyle. Your body is not able to absorb any of that stuff because you've been eating this. You're so acidic. So it has to be some type of cleanse you need to do to prepare your body to switch and go into a more plant-based lifestyle, at least 80% of the time. And then I started really recognizing the people I was around. A lot of the clients that I talked to have no support, even their spouses. Their spouses don't even know what to begin with fibroids. It's like, what's for dinner? Fibroids. Oh, okay. They have no idea. So, you know, we as women don't even know our bodies, let alone our spouses to know. So I had to be a part of a support system of like-minded people, not that had fibroids, but that I know that I can get support from and they can support me. So I had to get rid of some friends,
Yeah,
right, that were not
really,
serving me.
yeah, support is really important. I'm glad you brought up that. I wrote a blog piece, and if anyone is interested, our website is atlii.com, atlii.com. One of the recent blog pieces I wrote is about African-American women. I hear it all the time in the office say they just got to keep it moving. You had mentioned that earlier, how you kind of just take everything on. I mean, women in general are the nurturers, so they're responsible for the entire family's health, not just their own. But it's more than that. I really do think it's an African-American women, more specifically, because I hear it so many times in the office. You know, there is a long history, unfortunately, of kind of mistrust for doctors and mistrust for the medical system based on, you know, very valid experiences in the past that hopefully we get beyond. But as part of keeping it moving, you know, they don't, first of all, they may not realize what they're doing is abnormal because their mom did it, they've been doing it. It's like, it is really heavy and disabling, but they first have to recognize their amount of bleeding is abnormal. And so that's really important. If you're bleeding and changing pads more frequently than every 3 or 4 hours, that's too heavy. If you're changing 2 pads at a time, that's too heavy. If you're seeing clots, too heavy. If you're, you know, I had a woman today in the office that said her period was normal, but she was bleeding 7 or 8 days, 4 of which she would sleep on towels. You know, she wore the super heaviest pads possible, as well as tampons, changing every hour. She would get accidents in blood. She would, you know, and all of this she thought was normal just because she'd been doing it for so long. So, you know, as you mentioned, you've got to first understand what normal is. Even though you've been doing it a while, it can be abnormal. And then second, if you are anemic, it's obviously going to affect you physically, because as you mentioned, the loss of so much blood that you can't replace each month. With the blood, you lose iron and hemoglobin carries the oxygen that is responsible. And so the main symptom for anemia is fatigue. You're tired, you're weak. You might get lightheaded or dizzy. You might get palpitations, headaches. A big one is chewing and craving ice. When I ask people about that in the office, they're like, whoa, are you clairvoyant? Like, how did you know? It's a sign of anemia. And sometimes they can chew or crave odd things. It's called pica. In Georgia here, they often chew this white clay. It's crunchy. It's got kaolin in it, the main ingredient in kaopectate. So you can have these bizarre cravings, but realizing that that's not normal, and realizing you don't have to keep it moving, that you can, if you're suffering with these things, you've got to seek help from a supportive group and hopefully a supportive physician.
Right. Absolutely. So getting that support, and then I started to follow that regimen and incorporated just mindfulness. So I took time for myself. I started off with 5 minutes a day. I would just stretch, listen to some music, just not do anything for that moment, right? Because again, we're so used to moving about and doing everything that we can think of every minute of the day. So I just stopped. And then I started doing more plant-based foods. So I started with salads, preferably kale, which I know has more iron in it. I started doing ancient grains like quinoa, which has protein in it. And then I started adding more healthy fats like avocado or a handful of Brazilian nuts. And I would make that a meal. So those are kind of the typical meals I would have. And then my workouts were not like I was running a marathon because that's a lot on our bodies if we're not recovering in between workouts. So I started doing more healing workouts, and it's something I created where you still get the weight training, you still get the cardio, but it's more mindful, where your mind is connected to your body. That way your body's not producing a stress response, which it normally would when you do work out. So I followed that regimen, I would say, for about 3 to 6 months. And then I noticed a huge transformation where my heaviest cycles were like 8 days or were 8 pads a day. And that went down to like 3 pads a day. And now I'm actually, my menstrual cycles last as long as 3 to 4 days. And I'm changing no more pads than 2 or 3 a day, right? My iron levels went up, my energy went up. I really feel like a whole different woman. And also, there was it showed on the ultrasound that I had a 4 centimeter fibroid that did degenerate. Mm-hmm. So I feel it's a reflection of what I've been doing. But I just want women to know that, you know, you have to just be aware and do your research. I feel that surgery should not be the option. If anything, and you've waited, a minimally invasive procedure is somewhat considered, but for surgery, that should be the very, very last resort. And we're running into that because we're not aware of the symptoms that we think is normal. Right. And I know, Dr. Lipman, you can say more to this, but I feel like the medical community, they don't even know. They don't have any idea in regards to prevention, in regards to foods to eat, to even let us know that once we get this myomectomy, which is surgical removal of the fibroids, that there is a chance that they will go back, right? If you go back to what you were doing before.
Myomectomy, for those that are not sure what that is, it's a surgical removal of typically some of the fibroids. Usually there are way more fibroids in the uterus than the patient is aware of, and even the doctor sometimes is aware of, because ultrasound dramatically underestimates the number of fibroids in the uterus. We use a much more sophisticated imaging tool called MRI. And so I'll have patients that say, well, I know I have these 2 fibroids, we've been following them for a while, and they know they have those 2 fibroids based on ultrasound. And when we get the MRI, you see that they've got 10 or 12 or 15, and they're like, whoa, where'd they all come from? Well, they've been there, but ultrasound is a much lower resolution tool. And so it's really important to get accurate information, because you can't take all the fibroids out. And so what happens is they'll go after the biggest ones they can get out safely, because some women go in for myomectomy and unfortunately wake up with a hysterectomy. But presuming they wake up with their uterus, there's fibroids still inside their uterus. They tend to be the smaller ones, but those fibroids will start to grow. And if you're not doing the right things, you're not eating the right foods, you're not exercising, you just go back to the old habits, those fibroids will start to grow under this estrogen stimulation. And as they get bigger again, within 3 years, 4 years, maybe 5 years, the patient has all the symptoms she had previously, they're all back. And so they'll go to the gynecologist, and the gynecologist will say, well, those darn fibroids, they're back. Well, that's kind of a white lie. They didn't come back. It's ones you, the surgeon, didn't get out the first time. And so we've seen a number of patients with 2 myomectomies, 3 myomectomies, up to 5 myomectomies. And now they're coming to see me for a UFE procedure. So as you said, I mean, surgery should be the absolute last resort, particularly hysterectomy. I mean, in my opinion, there is absolutely no reason whatsoever for a woman to undergo hysterectomy for benign fibroids. I mean, why are we, a hysterectomy is an amputation. Why are we amputating young women with benign disease? So in my opinion, that should never be done. Could you choose it? Yeah, you could if you really wanted to, but most women don't want to do that. They're just not aware of any other option presented to them. And that's where you really got to kind of take more of an active role in your health and, you know, incorporate the things that you're doing and really being up on it and using the internet, not that everything on the internet is gospel by no means, but use it as a tool.
Absolutely. Yes. Thank you so much for getting specific on the myomectomy, because I feel that many women, including myself, had no idea on what the myomectomy entailed, and know that, it does not stop your body from producing that estrogen. It just removes fibroids, if at all the fibroids, and you still have the root cause still there. So being able to develop this regimen, I use this as a blueprint to help women overcome and prevent fibroids. So one of the things that I've been working with different doctors is, if they were to get whatever they choose, make an informed decision, whether a UFE, a myomectomy, whatever is best for you. I want to help you prevent your condition from coming back, getting worse, or even anything else, because I know with fibroids there are other risks as well. Like it can interfere with your thyroid. It can be a correlation with diabetes, especially with being linked to PCOS. So there's other things that can come about with not living a healthy lifestyle. So that's what I want to help women, millions of women, understand, is that we can prevent this from happening. We don't have to be going through this pain and suffering. And we need to educate our community as sisters and help one another out, and be aware that fibroids is not an end all be all. We can really have a quality of life. And that's one of the reasons I'm so grateful to be here with Dr. Lipman, because following this blueprint, I'm able to live the best life that I can live, and be in a place where I can help other women, empower them to do the same thing. So
yeah, and doing all the right things is not only great for your fibroid health. You've shown that doing the right things not only improved your quality of life dramatically, it improved your fibroid health. You avoided coming into seeing the mechanic like me. But it's also good for your overall health. Your cardiovascular health, I'm sure, is significantly improved based on all the things that you did and that you continue to do. You're on a different trajectory health-wise than you otherwise would have been. And so, that's great. I mean, hats off to you for that. We're starting to get some questions. So let's see, what's the difference between UFE and a hysterectomy? Oh, that's a great one. I'll take that one. Hysterectomy is a surgical procedure, just like also myomectomy is a surgical procedure. So myomectomy is when they take out some of the fibroids and then sew the uterus back together. Hysterectomy is surgically removing the entire uterus, either all of it or above the cervix, but it's removing the uterus surgically. UFE is a completely non-surgical outpatient procedure. Patients come into our center, takes me about 30 to 40 minutes to perform. They leave the same day with a Band-Aid. That's it, a Band-Aid. There's about a 5 or 6 day recovery at home. They're back to work within a week. So it's much safer than an operation. It's much less invasive. The recovery is much shorter. And importantly, you get to keep all your parts, because we mentioned earlier, losing your uterus will affect women. It can affect them psychologically, like a man being castrated. It can affect them sexually. There's a lot of sexual dysfunction after hysterectomy. It can cause urinary leaking, bone loss. There's just no reason to do a hysterectomy for fibroids when there is such a good non-surgical outpatient procedure like UFE that gives you the relief. I mean, it works in my hands over 90% of the time. You get the relief you're looking for, you avoid the risks and long recovery of an operation, and you get to keep all your parts. Let's see, is it trying to remove, or is some holistic approach to fibroid? Just what do you suggest about the holistic approach to fibroids? Well, I hope we covered that. Tell people where they can reach you if they want to be part of your fibroid program. how do they get a hold of you, and what does that entail for them? What do they need to do?
So you can go to www.fibroidqueen.com. I have resources there on how to get started. Now, with the Fibroid Fitness Challenge, you are given a regimen and coached by me, as well with other women just like yourself, to follow this blueprint that has helped me get the results that I have. And you would do it for so long, and you would have that accountability of making sure your symptoms are getting better, how you're responding to this. But holistic really means mind, body, soul. So you're communicating everything to get on the same page so you can restore homeostasis. And that is putting things back into balance. Your body is able to efficiently run better, because having fibroids, there is a dysfunction that's going on somewhere in your body. And fibroids is just a result of that. I really call fibroids like a garbage dump. It's collecting all your waste that you're going through. So once we're able to clean that up through the Fibroid Fitness Challenge, you can get more results with better energy, burning hormonal fat. But on Instagram at Fibroid Queen, you can come and kind of see my page. And I use it more of just like an education piece to help women know that this holistic journey is possible. And it's definitely a way to prevent your from your fibroids from coming back, and them from thriving as well. So at Fibroid Queen, check out my website, www.fibroidqueen.com.
Perfect. Question, I've already had a myomectomy. Can I still get a UFE, and will it be effective? Absolutely, yes. UFE knocks out all the fibroids in the uterus, not just some of them. Myomectomy only gets some of the fibroids surgically. So yes, if you've had a myomectomy, I see patients that have had, multiple myomectomies, unfortunately. In my opinion, you can get one myomectomy, but after one, the next time should always be UFE, because at that point you need a global therapy for fibroids, and there's only two. Hysterectomy is a global therapy, but you lose your uterus. And UFE is a global therapy. It treats all the fibroids, does it non-surgically and outpatient. And so that, someone that has had a myomectomy and their symptoms are back, absolutely look into UFE. Another one is, I have fibroids and it's taken over my whole life, but I don't want a hysterectomy. What are my options? Well, as we talked about, you can establish kind of the holistic approach of, the diet and exercise and losing excess body fat and trying to get your life in order from a holistic approach and see how that will improve your symptoms. If it's not enough to improve your symptoms, absolutely look into UFE. I don't blame you. I wouldn't want a hysterectomy either. UFE is a phenomenal procedure. Let's see, there was one other one about fertility. Oh, here we go. What are the risks of infertility with the UFE procedure? Well, there are some women that do not menstruate again after the UFE procedure. Now, I've done 9,000 or so of these procedures over the past 25 years. I've never seen anyone under the age of 40 that ever didn't have a menstrual period afterwards. As you get above 40, you start to see some patients not menstruating, but it's very rare. For a 40 to 45-year-old woman, it's about 1 to 2%. For 46 to 50, now you're talking about 5 to 10%. But typically, women that are 45 and above are usually not interested, typically, in fertility. So for the patients that are interested in fertility, your risk of infertility with a UFE is much lower, actually, than your risk for waking up without your uterus surgically. Because when you go in for myomectomy, every myomectomy patient has to sign a piece of paper saying, you understand that if they get into too much bleeding during surgery, or they physically can't get the uterus put back together, you're going to wake up without your uterus. So women go in for myomectomy and wake up with hysterectomy. Well, the risk for that is often way more than the risk of not menstruating after a UFE. So you got to kind of put your risks and weigh the risks and balance, what you want versus the risk benefit of the different procedural options. let's see. Do fibroids prevent childbirth? They can. I mean, they can alter fibroids can affect any part of the fertility pathway from conception all the way through to delivery. They can grow sometimes very rapidly during pregnancy. That being said, most women with fibroids have normal pregnancies. They may get monitored more closely with ultrasounds during their pregnancy, but most have uneventful, normal pregnancies. But fibroids can interfere. They can block the birth canal. They can cause preterm labor. They can cause the woman to have a C-section rather than a vaginal birth. They can cause a demise, unfortunately. So they can affect fertility, definitely, but still most women that have fibroids have a normal pregnancy.
And Dr. Lipman, I would add just a couple things.
Oh,
So
sure.
with the myomectomy, just know that when you're going into that, you have the scar tissue. And for the most part, if you were to become pregnant, they would totally eliminate you from having that vaginal birth, knowing that you've gotten cut with a myomectomy. So that's something that most women don't know. So just be aware of that. And also with the location of the fibroids in regards to pregnancy, I feel that that plays a huge role on on how the pregnancy is going to thrive, depending on where the fibroids are actually at. And I know a lot of women that have been able to conceive, successfully with fibroids, but there are some that if it's, literally on the lining, that can actually, cause a demise or early miscarriage and things like that.
It says, fibroids run in my family. Would a healthy lifestyle help me?
Absolutely. Absolutely. And the thing is, fibroids run in my family. And I have a sister, she does not have fibroids. So I do not believe that genetic predisposition is all that it plans out to be, especially things I was told by the doctor was like, oh, Phyllis, you have fibroids. It's just common in your race, so just get used to it. That's how the doctor delivered it to me. And I feel like that's an insult. You do have that genetic link, but once your body reacts to the environment in a way that puts it out of balance, it does produce dysfunction with the cells. And I feel that fibroids can develop due to that. But just to say that your mom has it automatically since you're going to have it, no. But if you are doing prevention as far as your diet, your lifestyle, I think that's going to play a huge role in preventing fibroids from growing.
Yeah, I mean, you're kind of the walking testament to that. You have fibroids in your family and you've turned it around completely without anything else other than doing, really good things, eating really healthy, exercise, yoga, manage your stress. You're the walking billboard for that. So, I mean, yeah, you absolutely can. You've got a certain genetic predisposition. Okay. You can't pick your parents, at least not currently. So we can't do anything about that. But if you can try to, do the right things as best you can, moderation, you said the 80-20. I mean, it's really hard. We have these discussions in the office about moderating and doing, changing the lifestyle of, and it's not easy. But if you can do some of these things and you can kind of stick with it, it will produce benefits, clearly benefits.
Yeah.
I have fibroids and I have pica. What can be done? Well, just pica is, as I mentioned earlier, there are some people that will eat kind of inedible things. As I say, in Georgia, a lot of times they'll eat this kaolin, this kind of Georgia white clay, dirt. Some people will eat cornstarch, argo, that's a common one, flour. It's all having to do with significant iron deficiency anemia. So you've got to get at the root cause. I mean, I'll see patients in the office that do those, pica, and they say, well, you know, my doctor put me on iron. Okay, well, iron's really hard to absorb for us, but you can take iron, it'll help. But you got to get at the root cause. I tell patients all the time, it's like you're in a canoe on a pond, and the plug at the bottom of the canoe pops out, and now water is coming into your canoe. Basically, you have two things. You have two choices if you want to stay afloat. You can bail the water with a cup over the back into the pond, that's iron, or you can figure out why you're bleeding so heavily and losing all this iron and fix the problem. Grab the plug and stick it back in the bottom of the canoe. That's the UFE procedure. Treat the underlying cause of the fibroids. Once your fibroids are treated and you're not bleeding so heavily anymore, now your periods are light, your iron and hemoglobin goes back to normal. You feel like $1 million, you have your energy back, you can exercise, you can do all of the things now. You can sign up for Phyllis's program and feel like $1 million, but iron alone is just not going to do it. You're just treading water. If you suspect someone close to you, a spouse, a sister, a mom, that may have fibroids, how do you approach that conversation in a sensitive way?
So one of the things is that when I was going through this journey, I was very skeptical about who I can trust, because I felt that I wanted to keep this to myself, and I didn't want anyone to look at me like I was handicapped dealing with fibroids. And that's sometimes the thing that we kind of deal with culturally, is like we didn't want to look like we're inferior, we didn't look like we want to look like we're sick. But after some time, I had to realize that this condition cannot be fought by yourself. You need support. And for those that you know someone that's dealing with this, just start off with just making them aware that you are someone they can trust, and whatever they're going through, that you are there for them. You don't necessarily have to go right into the fibroids and the symptoms right then and there, but just give it some time. Just let them know where you stand with them. And then after some time, maybe you do your own research and then approach them and say, you know what, I know you're dealing with this, but I heard that, you know what, these are the triggers. Have you thought about going to the doctor and getting an ultrasound? I'll go with you. I'm here for you. And coming from an empathetic, supportive approach goes a long way. If I had that, I think I would have been a lot further along. So,
no, that's great advice. Can you still get pregnant after a UFE? The simple answer is yes. I've had numerous children born after UFE. I've had multiple sets of twins. Interestingly, our births are typically full term and vaginal, whereas if you have a myomectomy, typically you're not going to get a vaginal birth. They're going to make you get a C-section. That's almost unheard of to have anything but a C-section after a myomectomy. But it requires a conversation with a experienced interventional radiologist that does a lot of UFEs, and it's a longer discussion. It's much easier. In fact, in my opinion, it's a no-brainer when you have somebody that's not interested in fertility. The choices are UFE versus hysterectomy. To me, there's really, I mean, UFE wins every time there, but when somebody's interested in fertility, it's a more complicated, more thoughtful, and it's a longer discussion. It really depends on the age of the patient, if she's ever had any surgery before, particularly myomectomy, how many fibroids she really does have based on an MRI. So it's a lengthier discussion, but the simple answer is yes, we've had a lot of children born after UFE, and say full-term vaginal births and multiple twin births. They want to know, tell us again what your website is. If someone wants to know what's your website and how to reach you.
okay, I think Portia already put it in, but it's www.fibroidqueen.com and at Fibroid Queen on Instagram. So that's where to find me, and just to get some information, get started with your healing holistic journey.
I want to make sure other questions here coming in. Some of these we've already answered. What is UFE? I mean, uterine fibroid embolization is UFE. It's also called uterine artery embolization. It's a completely non-surgical outpatient procedure that treats all the fibroids without any surgery. Basically, an interventional radiologist is the type of physician that does UFE. They steer a little tiny catheter under X-ray and deliver these tiny particles to plug the blood supply up of all the fibroids in the uterus. The uterine arteries branch like trees, getting smaller and smaller branches till you get out to the leaves. The fibroids are the leaves of the tree. And so I know what size those tiny peripheral branches are, and I can flow direct these little tiny particles to plug up all the fibroid branches. So the big trunk and the main branches of the uterus stay open, so the uterus stays alive and healthy, but all the fibroids will not. They'll die, and as they die, they soften and shrink. And as that occurs, a woman's symptoms go away. And we see patients in the office 3 months after the procedure, making sure that their symptoms are significantly better or gone, and hopefully see that all the fibroids are dead, because if those two things are in place, likely I'll never see her again. Why do doctors suggest hysterectomies instead of a holistic approach to fibroids? Well, yeah, I mean, they should. I mean, they should.
Yeah, yeah. I mean, they should. I feel like, you know, Dr. Lipman, I got to say, you're the only one of the doctors I've met with this extent into prevention. I feel like it starts from, you know, medical school. You can attest to this, that, you know, most you guys are not taught to prevent, just fix and cut, you know, for the most part. And it's starting from there and trickling into looking at the uterus as just like a utility organ, and not knowing that our uterus is part of us. It's more than just a function of having kids. Absolutely. And it's more than just you know, thousands of dollars that they would get. It's just not a business. We're human beings, right? And as women, we should not have to get rid of our uterus if we don't have to. And I'm going to tell you, women, to be an advocate for yourself. All this information that we've been saying, watch this on replay, write everything down, and that way you can be a better advocate for yourself, because this is one of the reasons why we're here, because it's not being communicated. And, right, you know, there's a lot to say about that.
Yeah, I'm surprised. I mean, I've been doing UFE, as I say, for the past 25 years, and still patients don't even know about it. It's really sad. Most doctors won't mention UFE as an option, and they'll only give the surgical options, and that's just wrong. Unfortunately, you have to kind of be your own advocate and know about these things. I wish, you know, more people would talk about it, but we're kind of right up against the hour. I just want to make sure everybody knows how to get a hold of us again. My website is atlii.com. They can find me on Instagram. It's dr_ my last name, dr_LIPMAN. And if they want to call the office directly, it's 770-953-2600. And I'll leave the last comment to you, Phyllis, but I really appreciate you coming on and talking about this, because it's such an important topic and it's such a prevalent condition. And I hope this has been helpful for people.
Absolutely. Thank you for having me at Fibroid Queen on Instagram. And ladies, just take this information and share it with your sister, your mother, all the women in your life, because this keeps happening. And unless we become aware and educate ourselves, we can get to the root of this, where we can live a life beyond fibroids.
Excellent. Well, thanks everyone for joining us. If there are any other questions, I'm happy to answer some of them offline. My email is my first name, John, John, @atlii.com. I'll try to answer them as quickly as possible, depending on how many questions there are. But once again, thanks for coming tonight, and hope that was helpful. And thanks again to Rolling Out for having this Health IQ segment.